Does this sound familiar? If you or someone you know struggles with snoring, you're not alone. Hi, I'm Dr. Wei Xiang from SL Aesthetic Clinic, and today we are diving into what causes snoring and, more importantly, how to treat it. So, what exactly is snoring? Snoring happens when the muscles at the roof of your mouth, tongue, and throat relax too much, causing a partial blockage of your airway. As air flows through this narrow passage, it causes the soft tissues to vibrate, and that's what creates the sound of snoring. It's not just annoying, it can also be a sign of other underlying issues. Now let's talk about the solution we offer here at SL Aesthetic Clinic, our anti-snoring laser treatment. This is a non-invasive long-term solution that could solve the problem for you. Research shows that up to 90% of patients who undergo anti-snoring laser treatment experience significant improvement in their snoring. So, how does it work? The treatment uses laser energy to gently heat the tissues in the throat, stimulating collagen production and tightening the oropharyngeal mucosa. This helps to expand the airway, reducing the vibrations that cause snoring. At SL Aesthetic Clinic, we add in a long-pulsed anti-yak laser on top of the conventional erbium yak laser for enhanced results. Each treatment session takes about 15 to 30 minutes. During this time, different sections at the back of your mouth are treated with the erbium laser, and to further tighten the oral mucosa tissue with an additional anti-yak laser. There's no need for anesthesia, needles or injections, and most patients feel just a warm sensation during the procedure. After the treatment, there's no downtime or special care needed. You can go right back to your daily routine. It's important to note that while snoring is common, it can sometimes be a sign of something more serious, like obstructive sleep apnea or OSA. If you or someone you know experiences heavy snoring along with symptoms like excessive daytime sleepiness or difficulty breathing during sleep, it might be OSA. OSA is a condition where the airway becomes completely blocked during sleep, causing pauses in breathing. This can lead to serious health issues such as hypertension if left untreated. If you suspect that you may be suffering from OSA, you will need to undergo a sleep study, and you might be started on treatments such as continuous positive airway pressure or CPAP therapy. In addition to laser treatments and CPAP therapy, there are other ways to manage snoring and OSA. Lifestyle changes such as losing weight, exercising regularly, quitting smoking, and reducing alcohol consumption can all make a big difference. In some cases, surgery might be necessary to correct anatomical issues that contribute to snoring. This could involve removing excess tissue from the throat or addressing issues with the nasal passages. Before we wrap up, let's take a quick look at what TikTok has to say about snoring solutions, and let's see if they hold up. Okay, this is regular snoring. And yeah, that sounds like obstructive sleep apnea. So this is a good example. If you listen closely, you'll follow for obstructive apnea, there'll be pauses followed by gasps of air. And that's a big red flag. Regular snoring should be consistent and rhythmic, but if sleep apnea is an irregular pattern. So if you suspect that you have sleep apnea, you should seek some professional help, because if left untreated, it can cause serious health issues such as high blood pressure, or sometimes increase your risk for heart problems such as heart attack. Oh, this is interesting. The guy is putting on the nasal strips and the nose clips while he's asleep. I mean, typically they should usually put this on before they go to sleep now. But yeah, the idea is that nasal strips can open up the nasal passage if the snoring is due to obstruction over here, and the nasal clips is to pinch and flatten the nasal septum a little bit if it is the septum that's causing some obstruction to your breathing. But by and large, if your snoring is due to issues at the back of your mouth or in your throat, then these nasal strips or nasal clips will not work for you. Right, get married, they said, and it'll be fun, they said. Yeah, very common problem, right? The guy snoring and then the girl cannot sleep. Sometimes it could be the other way around also. But what's important is that you need to know your snoring does not just affect you, it also affects your partner, because your partner will be disturbed, cannot sleep, and then both of you will have daytime sleepiness. So if your partner is like nudging you and saying, hey, your snoring is affecting me, or you should get something checked, please do so. It will help not just yourself, but also your partner, and both of you can get a good night's sleep.
So, does Dr. Aldides snore?
Oh, no lah, she doesn't snore. But if she snores, right, maybe I can do the anti-snoring laser for her. Right?